How are anemia and lymphoma connected? Blood tests explained. Imagine your blood as a busy highway carrying vital supplies to keep your body running smoothly. When something disrupts this flow, like anemia or lymphoma, it can cause significant issues. Anemia is a condition where your red blood cell count or hemoglobin levels drop too low, leading to fatigue, weakness, and pale skin. Lymphoma, especially non-Hodgkin lymphoma, is a type of blood cancer that originates in lymphocytes, a kind of white blood cell. But how are these two conditions linked? Blood tests, especially the complete blood count, are key to understanding this connection. Lymphoma can affect the production and lifespan of red blood cells in several ways. One major way is through infiltration of the bone marrow, where red blood cells are made. When lymphoma cells invade the marrow, they disrupt normal blood cell production, resulting in fewer red blood cells and causing anemia. This infiltration can be seen in blood tests as a low red blood cell count, hemoglobin, or hematocrit levels. Another way lymphoma causes anemia is through chronic disease and inflammation. Lymphoma is a long-lasting illness that can trigger ongoing inflammation, which interferes with how the body produces red blood cells and manages iron. This type of anemia is called anemia of chronic disease. Blood tests can reveal this by showing low iron levels despite normal or high ferritin levels, indicating the inflammation is affecting iron use. Nutritional deficiencies also play a role. Lymphoma or its treatments may lead to shortages of iron, vitamin B12, or folate, nutrients essential for red blood cell production. Blood tests measuring iron studies, vitamin B12, and folate levels help identify these deficiencies. In some cases, lymphoma can trigger autoimmune hemolytic anemia, where the immune system mistakenly destroys red blood cells prematurely. Blood tests like the direct antiglobulin test can detect this immune response. Treatments for lymphoma, such as chemotherapy and radiation, can also suppress bone marrow function. This suppression reduces the production of red blood cells, leading to anemia. Blood tests can monitor these effects by tracking changes in red blood cell counts over time. The complete blood count is the most common blood test used in this context. It measures the number of red blood cells, hemoglobin levels, hematocrit, white blood cells, and platelets. If the results show low red blood cells or hemoglobin, it indicates anemia. Additional tests like the reticulocyte count help determine if the bone marrow is producing enough red blood cells or if they are being destroyed faster than they can be made. Elevated lactate dehydrogenase levels, often seen in lymphoma, can also suggest increased cell turnover and may correlate with anemia severity. Symptoms of anemia such as fatigue, weakness, and pale skin often overlap with lymphoma symptoms, making blood tests essential for accurate diagnosis. Detecting anemia early allows doctors to tailor treatments, which might include iron or vitamin supplements, medications to stimulate red blood cell production, or adjustments to lymphoma therapy. In summary, lymphoma can cause anemia through direct invasion of the bone marrow, chronic inflammation, nutritional deficiencies, immune destruction of red blood cells, and side effects from treatments. Blood tests like the complete blood count and related assays are vital tools to detect anemia, understand its cause, and monitor its progress. Always consult healthcare professionals for personalized diagnosis and treatment, as each case can vary widely.